First on our list on the agenda items, we have Senate File 4107. Senator Mary Kunesh, welcome.
Thank you, Mr. Chair. Let me get my stuff together here.
No worries. I understand you have the A2 amendment as well.
Yes, I do. The A2 amendment is just some cleaning up with the appropriations, where the dollars should go, and the appropriation to the Office of Higher Education.
Awesome. Any discussion? Senator Kupek moves the A2 amendment. All those in favor say aye. Aye. Those opposed? The amendment is adopted. Senator Kunesh.
Thank you for that enthusiasm, Senator. This is the first time I think I'm presenting a bill in your committee, so I really appreciate that enthusiasm. I'm also very proud to author Senate File 4107 as the 2024 version of the Increased Teachers of Color Act. It's the 8th legislative session. This act has been introduced by both Republicans and Democrats, and I've now been lead author for 3 different previous versions as a representative and as a senator. This is such an important piece of the entirety of the Increased Teachers of Color and Indigenous Act. It's such a comprehensive bill, from recruiting to supporting the teachers, to maintaining those teachers, mentoring them, and providing the kind of resources. And as a teacher of 25 years, I know very well how important all of those things are. Nearly 40% of all K-12 students are Indigenous or students of color, but only 6% of all those teachers are BIPOC. This opportunity gap is a major contributor to our state's persistent and wide achievement gap in both our K-12 system and higher ed. Last session, we were able to make truly historic investments in several grant programs proposed to increase Teachers of Color Act, and passed many important policy provisions. One of the policies that we passed last session from the 2023 Increased Teachers of Color Act was the new official state goal of increasing the percentage of BIPOC teachers by at least 2 percentage points annually, so that by 2024, Minnesota's teachers reflect the racial and ethnic diversity of our students. The idea of a measurable state goal to increase teachers of color was inspired by Minnesota's higher education attainment goal, and supporting this bill will help achieve that higher ed goal. To reach the goals, we still have a lot of work to do. There are approximately 2,000 BIPOC teacher candidates enrolled in Minnesota preparation programs. They need assistance from the Aspiring Teachers of Color Scholarship Program to matriculate through and complete their undergraduate or graduate level preparation programs. This scholarship program has a pilot status, and the previous biennium appropriation has been extended. But this bill proposes that we codify this in statute with an infusion of one-time money. The Aspiring Teacher of Color Scholarship Program is needed to supplement the North Star Promise Program in several ways. Support BIPOC teacher candidates whose family incomes are higher than $80,000, to address the cost of attendance beyond tuition that will reduce loan debt carried by teachers who deserve to be paid more, and to support career changes and teacher candidates who have bachelor's degrees to seek licensure through graduate level teacher preparation programs, and lastly, to support BIPOC teacher candidates who are attending private colleges and universities. So in order to increase the percentage of BIPOC teachers just 1 percentage point, there needs to be a net gain of approximately 630 BIPOC teachers in the state teacher workforce. Every $1 million that we invest in this program will provide approximately 100 annual scholarships to aspiring BIPOC teacher candidates. Even if your budget doesn't allow for an investment in this scholarship program, Mr. Chair, I would strongly encourage you to include the proposed statute in your omnibus bill to strengthen this needed program for investments. And I hope that the Education Finance Committee, don't know, we'll have to talk to that chair, will make and hopefully future investments from this committee. So now I'd like you to hear from several testifiers who will share their views about the importance of this scholarship program.
Thank you so much for your testimony, Senator Kunesh. First up, we have Katia Zubeda, Minnesota Council on Latino Affairs. Welcome. Please introduce yourself for the record and proceed.
Thank you, Chair and members. For the record, my name is Katia Cepeda, and I am the Legislative and Policy Director in Education for the Minnesota Council on Latino Affairs. On behalf of the state's 3 ethnic councils and the Indian Affairs Council, I come to testify in support of the Increased Teachers of Color Act, as it is our top joint priority in education for the 2024 legislative session. We are proud of the bipartisan work the legislature has accomplished over the years on the Increased Teachers of Color Act to move the needle towards having Minnesota's teachers reflecting the racial and ethnic diversity of its students. One of the policies passed last session from the 2023 Increased Teachers of Color Act was the new official state goal of increasing the percentage of BIPOC teachers at least 2 percentage points annually, so that by 2040, Minnesota's teachers reflect the racial and ethnic diversity of our students. In order to increase the percentage of BIPOC teachers, just 1 percentage point, we need a net gain of approximately 630 BIPOC teachers in this teacher workforce. It not only addresses the shortage of teachers of color and American Indian teachers, but in doing so also addresses the overall teacher workforce shortage in our schools. The Aspiring Teachers of Color Scholarship Program is needed in order to support BIPOC teacher candidates who are attending private colleges and universities. It also supports career changers and teacher candidates who have a bachelor's degree seeking licensure through the graduate level teacher prep programs. The scholarship program has pilot status. The previous biennium appropriation has been expended, and this bill proposes it becomes codified in statute with an infusion of one-time money. We understand the budget may not allow for an investment in this scholarship program. However, we strongly encourage you to include the proposed statute in your omnibus bill. We thank you for the opportunity to testify in support of this important legislation, and again, urge the committee to support this bill to do the right thing for Minnesotan students and schools. Thank you.
Thank you so much for your testimony. Next up, we have Lakita Bice, teacher candidate at Metropolitan State University. We'll move on to our next testifier. We have Quantel Crawford, teacher candidate from the University of St. Thomas. Welcome. Please introduce yourself for the record and proceed.
Good morning, Mr. Chair and members. Thank you for hearing me out today. My name is Quantel Crawford, and I'm a teacher candidate at the University of St. Thomas's graduate level master's program paired with St. Paul Public Schools. This means that I take classes full-time and work full-time as a special education teacher at St. Paul's Hazel Park Preparatory Academy on the east side. Growing up, I was fortunate enough to have parents who valued contributing to their community by dedicating their life's work toward advocating for the well-being of their neighbors, friends, and family. As a member or as a social worker for Ramsey County, my mother taught me the value of helping others to navigate complex social systems in order to advocate for themselves and their needs in life. As the president of the North Area Football Association, I saw my dad's leadership, creativity, and love change how 10+ years of hundreds of St. Paul youth think of themselves, adding value to the important societal concepts such as goal setting, teamwork, and the effort required by oneself in order to accomplish their goals. All I ever wanted to do in life was make my parents proud. And now, due to the blessing that has come in the form of the Aspiring Teachers of Color Scholarship, I am able to overcome the staggering financial difficulties previously preventing me from pursuing my dreams. namely taking the torch my parents lit and keeping it alive by acting as a leader in my St. Paul community. This is something that I would not have been able to afford if it weren't for the Aspiring Teachers of Color Scholarship's financial contributions. In fact, this is not my first attempt at getting my teaching license. During my undergraduate experience, I was a double major in the fields of sociology and education. However, I was forced to drop my education major due to the final student teaching experience's requirement to teach for an entire semester full-time with no financial compensation. A commitment I could not afford, as I was already working full-time to pay for my schooling. Therefore, I implore you to please support the investment proposed today toward the Aspiring Teachers of Color Scholarship Program. For me and all the aspiring teachers of color who seek for our teaching population to reflect the demographics of its students. Thank you for your time today. I appreciate it.
Thank you so much for your testimony, Mr. Crawford. Next up, we have Eric Williams, who I believe is on Zoom. Welcome, Eric. Please introduce yourself for the record and proceed.
Thank you. Good afternoon, Mr. Chair and members. My name is Eric Williams, and I am enrolled in the licensure program at Metro State, and I look to finish in 9 semesters. I currently work as a special education teacher in the Minneapolis Public School District. I want to be a fully licensed teacher because I believe I have the passion and the heart to make kids believe in the importance of getting an education. I only had 4 African-American male teachers from kindergarten to 12th grade, and many black males in Minnesota don't have as many. The difference that I'm making with these kids I work with in schools is that I'm showing that I care, but I'm also being transparent and showing them who I am, someone they can relate to and believe in. My financial circumstances was one of the biggest challenges for me to go back to school. I know the Aspiring Teachers of Color Scholarship Program will do great for teachers of color if it's passed, because it lets everyone know that you're investing in a brighter future. And when you invest in getting quality teachers, the same teachers give quality education to all students across Minnesota. The difference between receiving or not receiving this scholarship will be big. Scholarships means a lot to me because they help take away the stress of not having to work another job, so I can focus on doing well in school and being prepared to be a great teacher. Continuing this scholarship program will not only mean a lot to me, but also hundreds of others, and it will give me and other opportunities that we could never dream of. Please support us in teaching and making a difference in kids' lives and in our communities. Thank you for hearing me out.
Thank you so much for your testimony, Mr. Williams. We'll be going back to Lakita Bice. Welcome. Please introduce yourself for the record and proceed.
For the record, my name is Lakita Bice, and I'm happy to be testifying today. Good afternoon, Mr. Chair and members. My name is Lakita Bice, and I'm a teacher candidate at Metro State University for K through 12 special education licensure. I also work as an 11th and 12th grade ELA teacher at St. Paul City School, which is a charter school not too far from here. I'm a mother of 5 children. I would be lying if I said that going to school full-time, working full-time and being a mom isn't hard. College at 30 plus with children is challenging. The academic rigor of college and grad school was not what I was afraid of. It was the cost. I began in the education field as a paraprofessional for a few years, and I will always have scholars ask, Ms. Lakita, why are you not a teacher? And what my students did not know is that the journey to becoming a teacher was a journey I could not afford. I always heard those horror stories from current teachers about how they work those unpaid student teaching hours. This fall, I was finally able to begin to pursue my dream of becoming an educator. And it would not have been possible without a Grow Your Own grant that I have currently, which is a grant that covers my cost for tuition and books for grad school. But the Aspiring Teachers of Color Scholarship is also a much-needed scholarship that will financially support more teachers of color like myself. This scholarship aims at increasing teachers of color. I am proud to say that in my current role as an 11th and 12th grade ELA teacher, many of my students have said to me in 11th grade, "Miss Lakita, you are my first Black teacher." Now, that made my heart warm, but it was a bit saddened because at the same time, our children deserve to see representation of themselves in the classroom. If you do not remember any of my words today, please remember this. Black students who have one Black teacher by 3rd grade are 7% more likely to graduate high school and 13% more likely to enroll in college. Teachers of color matter to all of our futures. Teachers of color cultivate strength and resilience, and more teachers of color will disrupt institutional inequalities that help with widening those social, economic, and academic gaps that exist between people of color and our counterparts. In my school, I see a lot of potential educators. My hope is that I encourage them to follow my path and become an educator. And I have to share this. This is not in my speech. Today, a child told me today, "Miss Lakita, I want to be a teacher, just like you." I hope money will not be an issue for that particular child, nor any of them that's going to go into higher education after. We need investments proposed in this bill to help increase teachers of color, and most of them will not be able to do it without investments in this bill. Thank you.
Thank you so much for your testimony, Ms. Bice. Are there any questions or comments from committee members? Senator Kupek.
Thank you very much, Mr. Chair. Thank you, Senator Kunesh, too, for bringing this bill forward. I know in the Moorhead School District, we have about a 40% BIPOC population of students, and we have under 1% of staff are BIPOC. So definitely needed. I do have one quick question here, and I don't know if somebody maybe from the Office of Higher Education, it's just in the handout that was included in here. I was just looking through, I love tables. I was just looking through the tables of the institutions that had students that applied, and I was just, I just noticed that my 2 institutions in my hometown are not in here at all, and they both have teaching programs. Do they just have nobody that applied for them? Or, I'm just curious. I don't know, whoever.
Ms. Oliver, would you like to come up?
Sorry to haul you up here, but.
Mr. Spees, you may come up also if you'd like.
Hi. For the record, my name is Nikki Oliver. I'm the Director of Government Relations and Community Engagement for the Minnesota Office of Higher Education. Chair, Senator, my guess is there's probably not individuals that applied from those institutions for this, but I can verify unless Paul has an answer, but the individual applies. So if there were no individuals that
Sure.
applied from those institutions, that's probably what you're seeing.
Mr. Spees?
Mr. Chair, Senator, that's exactly the case. There needs to be the individual student to apply. That doesn't mean that the students of color and American Indian students at these institutions in Moorhead don't have the need.
Sure.
They might not have known about the scholarship program or
Right.
whatever.
Mr. Spees, can you also introduce your name and title
I'm
for the
sorry.
record?
I'm sorry. Paul Spees, Coalition to Increase Teachers of Color, American Indian Teachers. I'm sorry, Mr. Chair.
Thank you, Mr. Spees. Senator Kupek.
Well, thank you, Mr. Chair, and thank you for those answers, but I think that might also go to some of the problem too. So that's why I asked, just to identify that, we have a severe lack and want to make sure that we're getting more. So thanks.
Thank you, Senator Kupek. Senator Putnam.
Thank you, Mr. Chair, and I really mean that. Mr. Spees, I actually have a question for you, and perhaps this is in some of the materials. You know, I've seen you present to this committee for a couple of years now, and so I will acknowledge the own deficit of my own understanding. But St. Cloud has one of the highest percentages of teachers of color in the state, significantly. I think we're around 8 or 9% teachers of color in St. Cloud. Of course, our student population of color is over 50%, so that's still not an appropriate ratio. But one of the things that I've noticed in some of my own work trying to build this sort of capacity is that we do have a tremendous number of folks already working in the school district who are people of color as paras. And so the para to professional path is a great way to get people into teacher licensure because there are already people with a heart for teaching who are already in that space. But one of the things that when I think about that I also think about is the different disciplinary needs or concerns. You know, how many people of color are becoming teachers of math versus English in these other different areas. Do you track that sort of specialty or expertise? Do you intervene in it in efforts to encourage perhaps more math teachers or things like that? Or could you just talk on that a little bit?
Mr. Spees?
Mr. Chair, Senator, thank you for the questions. Yeah, those data are tracked not only by individual program, teacher preparation programs, but as they report to PELSB, the state licensing board, as well as the grantee or grantor agencies, whether that's the Office of Higher Ed, keeps track of candidates when they apply for this Aspiring Teacher of Color Scholarship Program. They keep track of, you know, what areas people are going into, as well as the Grow Your Own programs that are funded to support school districts, and the CUGMEC grant program that's also part of the Increased Teacher of Color Act, the Collaborative Urban and Greater Minnesota Educator of Color Grant Program, or CUGMEC. So those are there are a variety of ways that those data are kept and reported to agencies. The issue of trying to get more people in these high need areas, whether it's math or special education or several other, there's a lot of shortage areas in the state, as you know, and depending on the geographic region, some of those areas vary. And what might be a shortage in one area is not a shortage in the other. But the work is part of every school district's efforts and part of every higher ed institution's efforts and even alternative providers' efforts to try to get not only BIPOC teachers to be in the classroom, but also fill these high shortage needs as well.
Senator Putnam. Good. Thank you, Mr. Spees. Are there any questions or comments from members? Seeing none, any closing comments? Senator Kunesh?
Thank you, Mr. Chair and members, for listening to this. And some of these members in this committee sit on my committee in Education Finance. And Lakita was talking about how, in spite of being mid-30s and having children, how she was persevering through to get her degree. And my story is not much different than that. I went to college for a year and a half and had to drop out because I couldn't afford to go to school anymore. And life happened. I got married. Had kids. But in my mid-30s, I found myself a single mom, and I went back to college, weekend college. So I was doing family daycare during the week and then going to college on the weekends to get my teaching degree. And it wasn't easy. It was hard on my family. I mean, my kids will look back at that time and kind of lament about, you know, me not being around a lot, but they saw me working hard, and I think it was a positive role model for them at the time. But it wasn't easy, and when I came to graduate in December, I found that I was broke. I had tried to save as much money as I needed during my student teaching, and it didn't go as far as it needed to be. I had a job lined up with Minneapolis Public Schools, and I couldn't get my license because the government went on shutdown. So what was I to do? I ended up on public assistance, which is a really hard thing for a person to do sometimes, to ask for help like that. But if it hadn't been for those dollars that the state provide, you know, it was welfare at the time. So the money that was allotted, the food stamps, I remember hiding from my kids when I paid for food with food stamps because I was still very embarrassed. And the health care that we received, you know, I would have lost my house and my kids wouldn't have eaten and all of those sort of things. So if we can provide these students with some extra assistance to ensure that they can finish this program, that we can support them at their time, you know, to come to the end, to complete the end, and not go broke, not get on public assistance. I mean, it's probably more money to support a person or a family on public assistance than to give them a few dollars to get them through a tough time and have a really positive outcome. So I would really ask you to consider our request here today, and knowing that it makes a big difference when we invest in a family and in our teachers of color and our students as well. So thank you.
Thank you so much, Senator Kunesh. So I will move that Senate File 4107 be recommended to pass and re-refer to the Committee on Education Finance. Senate, yes, SF 4107 as amended be recommended to pass and re-refer to the Committee on Education Finance. All those in favor say aye. Aye. Those opposed? The bill as amended is passed and re-referred to the Education Finance Committee. Thank you. Next up, we have Senate File 4912, Senator Wiklund. Welcome. And before we begin, I understand you have the A3 amendment.
I do, Mr. Chair. It's not, I mean, I'm coming from the HHS committee. This amendment, the A3, is meant to incorporate some feedback that I received after presenting the bill in the Health and Human Services Committee. It makes some changes that were brought to me, or feedback that I received from the University of Minnesota, and then also some feedback that I received from the Department of Health. It doesn't change substantially the bill structure, but it defines some terms in a better way and makes the language more clear, I think. So that's what the A3 does.
Awesome. Senator Kupek moves the A3 amendment. All those in favor say aye. Aye. Those opposed? The amendment is adopted. Senator
Thank you.
Wiklund.
Thank you. Yeah, I'm happy to be able to discuss Senate File 4912 today. It is a bill that I've been working on in collaboration with the University of Minnesota, and is kind of a product of work done on the academic health, the governor's academic health task force, which I was a member of. And so we came out of that process of the task force, which worked from last September through to January. And a report was issued towards the end of January, early February, that presented the recommendations from the task force, as well as a description of the process and the steps that we took to come to the consensus on these recommendations. These recommendations are meant to help us strengthen our academic health system in Minnesota, and also to ensure that we have recommendations that will help us develop our workforce, our health workforce in Minnesota, and our research and clinical care capabilities. And so the bill has, I set out to not, it doesn't include certainly, majority of the recommendations or anything like that, but I tried to focus on areas that I felt were important for us to address this session. One of the first section of the bill, it addresses collaboration between the University of Minnesota and the legislature. One of the discussion points we had was how could the legislature be better informed about the needs of the university in terms of developing their academic health sciences programs. And so that is what the first section, it requires more documentation ahead of introduction of bills that they want to bring forward to help us understand the reasons for appropriation requests. It also requires a report that would help us understand on a yearly basis more about how investments are being made. The second part of the bill addresses workforce planning and development and requests that the Department of Health develop a report on how we could implement a workforce health professions workforce advisory council in Minnesota to help us do better overall workforce planning related to health professions. And then the last part of the bill lays out the University of Minnesota's vision for specific programmatic purposes that they would devote a request of $80 million to support the academic health sciences programs at the university, and how those programs would also benefit the state of Minnesota and our health goals as a state. So those are the three kind of main components of the bill, and I have a couple testifiers who will be able to talk more about it.
Thank you, Senator Wiklund. First testifier is Dr. Tim Shacker. Welcome. Please introduce yourself for the record and proceed.
Thank you. My name is Tim Shacker. I'm the Executive Vice Dean for the Medical School and an infectious disease physician at the University of Minnesota. Thank you for having me here today and for taking the time in this busy session to hear Senator Wiklund's bill and to focus on our $80 million supplemental request. We are at a transformational time in health sciences, and you all know how fast healthcare is changing. We are seeing healthcare worker shortages all across the state. We are seeing a stressed workforce with more need for burnout prevention and different thinking around healthcare delivery and workforce models. We are lucky to live in a state with so many leaders who care deeply about the health and the health of the state, and frankly, about the University of Minnesota. I want to make clear that our request is in response to what we heard from the Governor's Task Force on Academic Health. We heard that it is critically important that the U be a strong partner in meeting healthcare needs by improving access, by innovating care models, as well as cures and treatments, training the professionals we will need as our population continues to age, and creating more access to both primary and also subspecialty and specialty care in greater Minnesota. We know that the state and other systems want more collaboration. We do too. We know that we need to think statewide about the services delivered and where there are gaps. Here is our plan. It breaks down as follows. We are requesting $25 million per year for 3 to 4 new medical discovery teams in fields like mental health, infectious disease, cancer, cardiovascular programs, and population health. We will build on the very successful model funded by the legislature in 2017, where we established 4 medical discovery teams focused on addiction, aging, brain health, and rural and Native American health. The investment has been a magnet, attracting more than 40 top researchers to Minnesota, who have successfully competed for $135 million in new NIH funding. These are the dollars that will lead to new discoveries that can transform healthcare, delivered by world-class providers. These are the dollars that will provide new training and research opportunities for Minnesota students and lead to more startup companies and jobs. We are requesting $20 million a year to invest in sustainability and access for underserved communities. This will be accomplished by building on the success of the Community University Healthcare Clinic, or CUC, located in Minneapolis's Phillips neighborhood. It is an interdisciplinary clinic delivering dental care, mental health, medication management, and medical care, as well as access to legal and social services. This interdisciplinary approach has led to significant improvement in patient outcomes. With additional public support, we could expand that model of interprofessional care across the state. In addition, we will expand on successful mobile health partnerships that we have with Hennepin County, where medical and dental care is delivered directly to the neighborhoods that need it the most. And we will provide more support to the medical school's primary care clinics, many of which are located in areas with very limited access to health care. We are requesting $10 million a year for primary care transformation. This includes e-consults, improving the transition for patients from primary care to specialty care when they need it, and then back again to their primary care. Building physician networks, continuing medical education, and advanced telehealth. This will result in better access to primary care around the state, better support for physicians in rural and underserved communities, and access to specialists for more patients. We are requesting $15 million per year for workforce development. The university's 6 health science colleges can develop and expand workforce development opportunities for additional medical student slots, new programming in high-need areas such as mental health, respiratory therapy, and advanced dental therapy program, expanding the addiction mental health track in residencies, and pathways and partnerships with Minnesota state and private colleges for high-need professions such as nursing. The outcome will be more physicians and other healthcare professionals. We are requesting $5 million a year for a new care model design that we call the Center for Learning Health Systems Science. This is a collaboration between the School of Public Health and the medical school. Their focus is to rapidly evaluate new approaches to care that will improve patient outcomes. Here is an example of the work that they do. In the last year, the team implemented and evaluated new approaches to virtual stroke care with the goal of providing consistent evidence-based care to non-stroke certified hospitals which lack specialty staff and services, especially in our rural communities. The result of this effort was a shorter time to appropriate treatment and significantly improved patient outcomes. This has dramatic applicability to healthcare providers across the state. Finally, we are requesting $5 million per year for innovation opportunities. These include a rural health clinic trials network. We want to bring our clinical research opportunities out into the communities where the patients live. Targeted collaborative efforts to solve specific health challenges. This will result in innovative approaches to shared challenges. I want to take just a moment to talk a little bit about what we mean by academic health. How does it relate to the overall healthcare ecosystem serving Minnesotans? I've already mentioned how our medical discovery teams help to transform discovery into care and help to drive the healthcare economy of Minnesota. Our innovative approaches to providing care in underserved communities and how the Center for Learning Health System Science tackles important problems and rapidly drives solutions that could impact every healthcare system in the state. But academic health is much more. We have 6 health science schools at the university: dentistry, medicine, nursing, pharmacy, public health, and veterinary medicine. Our combined mission is to educate the next generation, meaning we must always imagine the world our students will face in 4 to 8 years. In addition, we conduct research that seeks better treatments to improve health and well-being for patients and families. We provide care for anyone in the state and specialize in treating the most complex medical problems. We do this through partnerships and relationships with virtually all of the healthcare providers across the state. We work with communities to find new and better ways to deliver healthcare. When education, research, and clinical care work together, that is really what we mean by academic health. Here are recent examples. In 2020, the world was coming to grips with a pandemic that ultimately claimed the lives of 15 million people. Within weeks of the discovery of the cause of COVID-19, a scientist in the School of Veterinary Medicine was the first in the world to identify the part of the virus that attaches to our cells and causes COVID-19. That discovery led to many of the treatments used to prevent and treat COVID worldwide. 2 weeks later, scientists from the medical school used that discovery and, working with a team of graduate students and postdocs, were one of the first to develop a sensitive antibody test that was used clinically 1 week later. In April of 2020, Governor Walz asked the University of Minnesota, the Mayo Clinic, and the Minnesota Department of Health to deliver 50,000 COVID tests a day. It took us a few weeks, but we did it. In May of 2020, we began testing wastewater from 44 treatment plants statewide so we could accurately predict and anticipate surges of the virus. Now we are adapting those tools to identify flu, RSV, and other infectious threats to warn clinics and hospitals of coming health needs. The headline I ask you to remember is that the science of healthcare is always advancing, and academic health enterprises such as ours are critical partners in driving that progress. Scientists at the university have recently developed new MRI technologies to give patients more rapid and accurate diagnoses, especially of complex neurologic and orthopedic problems. We are pioneering the use of deep brain stimulation to treat Parkinson's disease that doesn't respond to conventional therapies. We are developing new treatments for cancer that doesn't respond to chemotherapy. These new approaches can cure up to 1/2 of people who would otherwise have died. Our students and faculty who teach them benefit from the 6 disciplines of our university. Our School of Public Health is one of the largest clinical trials programs in the world, critical during COVID. They are leaders in health policy research and work with community members and healthcare organizations to test and implement new approaches to the delivery of healthcare. Our School of Nursing educates nurses, but more importantly, these are the leaders who teach nursing students at most nursing schools throughout the state. Did you know that one of the main drugs used to treat HIV was developed here at the University of Minnesota in the College of Pharmacy? And many of my patients are alive today because they can take that drug. I've already mentioned the important contributions of the vet school to the veterinary school in the fight against COVID, but they are also at the forefront in the study of chronic wasting disease in our deer populations and mosquito-borne diseases like Zika virus that pose a real threat. Our School of Dentistry was the first in the nation to develop a program to educate dental therapists who can treat patients with no access to dentists. Together, the 6 academic health schools continue to make important innovations to solve health issues for everyone in the state. Our hospitals provide complex care for complex conditions that honestly cannot be treated elsewhere. Organ and bone marrow transplants are done in our hospital every day. We get referrals of patients from every corner of the state with cancer, autoimmune diseases, complex cardiac or neurologic diseases, or infections that have failed traditional therapy. In your packet today is a copy of Sunday's New York Times Magazine about a new approach to resuscitation of people who have had sudden cardiac death. Their hearts stop beating. This program is unique nationally, was developed at the university, and has successfully saved the lives of more than 100 Minnesotans who otherwise would have died. Part of our mission is to train the healthcare workforce of tomorrow. We know that 70% of the physicians practicing in Minnesota are educated and trained by us. We also train 70% or more of the dentists, pharmacists, veterinarians, and public health professionals from Minnesota. And as I said, our nursing school graduates a majority of the nursing educators. Rural health is a priority. In the medical school's Rural Physician Associate Program, 53-year history, it has placed more than 1,600 students, medical students, in 120 Minnesota communities for a 9-month period to work alongside primary care physicians. 75% of those students go on to become primary care physicians, most practicing in the rural community. This is why we are partnering with CentraCare to open a new campus in St. Cloud and are expanding the program in Duluth to a 4-year program. Our experience has taught us that if you train in Greater Minnesota, you will be more likely to stay in Greater Minnesota and practice. You've asked about the value of academic medicine and academic health to the people of Minnesota. We translate discoveries into care. We train most of the health professionals in the state, and we take care of the people that need us the most. We believe we are a vital part of the health of the state, and we look forward to working with partners across the state to address the pressing healthcare needs of our population. Thank you for your attention.
Thank you so much for your testimony, Dr. Shacker. Our last testifier is going to be Chen Wei Yan, a student at the Pharmacy and School of Public Health. Welcome. Please introduce yourself for the record and proceed.
Yeah, hi everyone. Thank you so much for having me today. My name is Chen Wei. I'm currently a second-year student in the College of Pharmacy, but I'm also pursuing a dual degree in, like a joint program between pharmacy school and the public health. So I also received my bachelor's degree from the University of Minnesota, and then what brought me to the college in the very first place is the tremendous support they have for students who want to explore research. And then I attended the College of Liberal Arts, and then knowing that I want to go to healthcare sometime in the future, I got connected with so many different researchers who are doing their research programs, and then also through just through a series of academic seminars, I was able to get connected with my current research mentor, who I've been working with for almost 4 years now. And then what drew me to her research is her focus on rare diseases. So I'm actually right now working as a research assistant at our Center for Orphan Drug Research. And for my research trainings, I was not only able to perform some bench work and do some cell culture, but also very thankful to the healthcare professional network we have. I was able to shadow interprofessional teams at a specialty clinic, which provides care to the rare disease communities. So I was there joining the team, seeing a group of physicians and also genetic counselors, and then working with them and just seeing how they would talk to people about their new diagnosis and talking about their specialty medication. So that's a very meaningful experience for me. And then for my current pharmacy trainings, I find this dual degree program very helpful for me just to leverage my skills in my research, my clinical care, but also learning more about the communities around me and then contribute to their care in the future. So yeah, that's a brief summary of what I have.
Thank you so much for your testimony. Are there any questions or comments from members? Senator Umuver-Bin.
Thank you, Mr. Chair. My question is just for anyone from the University of Minnesota. I see the 20 million in Section 5 for underserved communities, and then the community university hospital clinic specifically named as one of those potential areas. I've mentioned this committee before, just having the opportunity to visit Cook and being so impressed by that model. I'm sure they'd love the entire 20 million, but can you tell me a little bit more about the investments that could be made there and sort of what that work would look like? I'm looking at, again, at line 5.27, investments in the community university hospital clinic.
Dr. Shacker.
Thank you. What our plan would be is to take the model that has worked so successfully at Kook and just, broadly we think of that as interprofessional or interdisciplinary work where all of these specialties are working right next to each other. And while we wouldn't take, Kook and expand that, we would propose taking that model and developing it elsewhere in the state where, we need that kind of care. So it's really to take that money and set up new clinics that are interdisciplinary like Kook. Did that answer your question?
Senator Umuver-Bin.
Thank you, Mr. Chair. And yes, that's helpful. Just a follow up. And in visiting there, heard from staff just the folks that they are serving across the state and many who are driving, even further distances to access that care because it's such a great model. So do you have any places particularly in mind that you're seeing a lot of patients sort of come in for? It'd be helpful to have that model or to have that sort of clinic in a different space.
Yeah.
Dr. Shacker.
Thank you. That work is beginning as to, where the areas of greatest need are throughout the state, but I think, there are some real obvious examples. I also want to emphasize the idea of the mobile health clinics that we operate now, and we would expand those and, again, target those to the areas that are the most underserved.
Good. Are there any questions or comments from members? Seeing none, any closing comments, Senator Wiklund?
No, I mean, I think that the testimony shows, the breadth of the opportunity for us with the resources that the university has and what additional resources could allow them to do. I think the other work that we can do to strengthen our relationship between the legislature and the university in terms of understanding these investments and providing input on, what we see as the greatest needs in our state and kind of having a vision for that. I think Minnesota is particularly suited to a great deal of growth in this area. We have a lot of opportunity with the university, but we also have a greater medical community in Minnesota that's very strong, and other entities in Minnesota that we could, collaboration, I think, would allow us to really expand our impact on Minnesotans and better the healthcare access in our state. So thank you for allowing me to present the bill today.
Thank you so much, Senator Wiklund. I will move that Senate File 4912 as amended will be recommended to pass and re-refer to the Committee on Health and Human Services. All those in favor say aye. Aye. Those opposed? The bill as amended is passed and re-referred to the Committee on Health and Human Services.
Great. Thank you very much.
Thank you so much. And with no further business, we are now adjourned.